Hi, it's Dr. Smith from Wigston Central Surgery with another video to help us work well together to provide you with the best care that we can. Now, we're very privileged to have an amazing health centre to be able to use for the day-to-day runnings of our general practice. But we're aware that the building is sometimes tricky to navigate, especially if you're a new patient, and we're aware that we've had a number of new patients join us in the past few months and years. So I thought it'd be helpful just to make a quick video to try and help us navigate the building, help you know where you're going for your appointments, and therefore hopefully when you do need to use our services, you know where to go. So I've taken a number of short videos around the building and I'll talk you through them to hopefully help you be able to navigate the building in future. Okay, let's have a look then. You'll notice that Wigston Central Surgery is in 2 Steeples Medical Centre, and it's not the only general practice within the building. Bushlow Surgery is also here. And the building is also used for other additional services. Sometimes we have different organisations coming in and providing services within some of the rooms, so it may well be that you have appointments for other things within the building. As you go in through the automatic doors, you'll find that you'll meet yourself with a long reception desk. Patients for Wigston Central Surgery need to go to the section in the middle. Patients with Bushlow Surgery, the section on the right. And on the left of that area for Wigston Central Surgery is where you go to sign in if you're seeing one of our additional services. And then once you've signed in at reception, you can take a seat in the waiting room. Now, the consultation rooms downstairs are located to the right of the reception area. And so if you go through there, the rooms from Wigston Central Surgery going from right to left are rooms 11, 12, 13, and then if you keep going along the corridor, there's 14, 15, and then Dr. Sardev hiding around the corner in room 16. So those are the consultation rooms downstairs for Wigston Central Surgery, and as I say, the corridor is located to the right of the reception area. But what about the other consultation rooms? Well, to the left of the reception area is the pharmacy, and beyond the pharmacy is the access to the first floor. Now, there is a lift for patients just to the left of the reception area, and another lift in the stairwell here. But let's go up the stairs, shall we, so that we can have a look at the waiting area upstairs and see which consultation rooms we find up there. Consultation rooms downstairs are predominantly for our doctors. The consultation rooms upstairs are both for nurses and doctors, and also for phlebotomists and other staff. So if, for example, you're having a blood test, it's quite possible that your appointment may be upstairs. From the waiting room upstairs, you can again access the rooms by going through the door to the back. On this occasion, there are more rooms upstairs that belong to Wigston Central Surgery. So from right to left, there's room 25, and from 25 it goes all the way down the corridor. You'll see 28's in front of us there, and it keeps going. The room at the end of the corridor there is room number 31. So that gives you a little bit of an idea of the layout downstairs and upstairs, but there's a couple of other rooms that are often tricky for patients to be able to find. So first of all, let me talk you through rooms 32 and 33. These rooms are often used for blood tests, but sometimes they're used by clinicians for having consultations in. And you'll notice as you come to the end of the corridor, there's a sign there for rooms 32 and 33. They're located just the other side of the stairwell. So hopefully you can visualise that in your head from the waiting area. You've got a corridor of rooms upstairs, and then at the side you've got room 32 and 33. But there's another one that's also quite tricky, and that's room 36. So why don't we have a look from the waiting room and see where room 36 is. So if you're going from that waiting room again, this time you're going to go off to the side, and room 36, which is often used for blood tests, can be found just to the side there. So hopefully that gives you a little bit of an idea where all the different rooms are for Wigston Central Surgery within 2 Steeples Medical Centre. Even knowing that, it can be a little bit disorientating leaving a room and trying to work out where to go. So why don't we just imagine for a moment if we've had a consultation and you're leaving my room. So you come out of the room, and then you go down the corridor in order to get back to the stairwell. Remember, there are lifts available both in the stairwell and also back towards the waiting area. It's worth pointing out that there is a second floor above this one in the medical centre. That floor up there is used for some of our administrative staff. It's where we have clinical meetings, it's where there's also meetings for the PPG, and we do lots of training of students and medical students. I hope that's given you a little bit of an idea of the outline of the building. I realise it's a little bit tricky sometimes to know where your appointment is, and that can be a little bit unsettling at times. But I'll just recap some of the consultation rooms. For Wigston Central Surgery, rooms 11 to 16 are on the ground floor, and then rooms 25 all the way through to 36 are on the first floor. The rooms downstairs are occupied by doctors, and then the rooms on the first floor can either be occupied by doctors or phlebotomists, nurses, or some of our other staff. Well, there you have it. Hopefully that gives you a little bit of an idea of how to navigate the Two Steeples Medical Centre so that when you come to Wigston Central Surgery, you have a bit of an idea where you're going, and that will prepare you for your visit. We'd love to have some feedback from you. Do you find these videos helpful? And also, have you got any ideas for things that might be helpful to cover in future? Take care.